Jack Benjamin once said that the application of GIS is limited only by imagination of those who use it. Ladies and gentlemen, you're welcome to join me in this presentation where I'll be sharing with you the application of GIS in the fight against COVID-19 in Kampala City and Uganda at large. I'm Flavia Zabali Musisi, the head of the GIS unit in Kampala Capital City Authority, the body that runs Kampala, the capital city of Uganda, on behalf of the central government. Kampala, like many other cities in Uganda, wasn't ready for the COVID-19 pandemic, and it took us by storm. With an area of 159 square kilometers, Kampala has a night population of around 1.6 million people and a day population of over 4 million people. Now, the challenge is the majority of these people, close to 80% of the day population, is always within the central business district of Kampala. That means there's a lot of congestion, and there was need to find ways of stopping and limiting the spread of COVID-19 in case it went into these people. As strategy, we dived into the science and technology of GIS for better health through location. And here we created the COVID-19 Response Hub to support the Directorate of Public Health and Environment within Kampala Capital City Authority, but also the Ministry of Health and the National Task Response Team. We created the COVID response with a vulnerability analysis for the Greater Kampala metropolitan area. Health facilities were mapped, ambulance services were mapped. We mapped and made dashboards for points of entry to be monitored, but also to monitor quarantine centers within the city and the country at large. This was the day-to-day activity of the COVID-19 response teams in Kampala Capital City Authority, but also at the Ministry of Health. This was their day-to-day activity. They were very busy. They were up and about the place to make sure that they deliver service and fight against COVID. This is the outlook of the COVID-19 response hub of Kampala Capital City Authority. When you go to the Kampala Capital City Authority website, this is what you'll find. It is the first thing that will welcome you. Inside this hub, we have applications, we have story maps, we have a survey, but we're also using it as a communication platform. The link here takes you to the hub. In case someone is interested, you can follow the link. The hub has so far been visited by over 20 million people. Speaking of the apps within the hub, we have the main app showing the country, the map of Uganda with the districts, the sub-counties, the parishes, up to the village level. And it shows the distribution of COVID cases within the country. We have the numbers of the confirmed cases, the numbers of the recovered cases, the numbers of people who have died due to COVID, and also those who are active cases. And we are lucky that most of the people who are sick with COVID recovered in Uganda. And we thank God for that. And we thank the system. We also have the second application, which was showing health services. And here we have health services at different levels, from the hospitals all the way to the health centers. But we also have quarantine centers and test centers. These were created for people who are at home during the lockdown to be able to understand the nearest facilities to them in case they need it. Because at that point, public transport and private transport were all locked up, and people could only access facilities either by walking to those facilities or by cycling to those facilities. So it was important to understand the next facility, the closest to you, to be able to access the services that are required. We had one that was showing public and private institutions like banks, like shopping malls, like markets, government offices, among others. for people to be able to know in case they wanted services, where to go to. Then we had a heat map for ambulance coverage. And here we also had hotlines for people to call to access ambulances. Well, from the map, we can see that CBD, the central part of Kampala in yellow, had the most ambulances, but also has the highest population of people. So these were support apps for the communities to access information right on the go. We had a survey. The survey was done for the Greater Kampala Metropolitan Area for reasons. The Greater Kampala Metropolitan Area is the area that houses or that acts as the dormitory for Kampala, the city. Most people who work within the city sleep within the Greater Kampala area. So it was important to map the Greater Kampala area because what happens within the city directly affects the Greater Kampala Metropolitan Area. So we had a survey which was done twice. The first time we got 2% feedback for a population of the Greater Kampala Metropolitan Area. So this wasn't representative enough. Now we used the Craigie and Morgan sampling method to determine the sample size. The next time we ran the survey, we got a representative sample, which we used to do analysis and assess vulnerability in regards to exposure, adaptive capacity, and susceptibility. And we actually wrote a paper about it. Now, this analysis supported the government in distribution of food to people who are most vulnerable, distribution of masks, first to the people who are most vulnerable, but also to the rest of the country. You can follow the link to the publication for more details on this vulnerability mapping. Then we had to counter the infodemics. There's too much information, but some of the information that was going around wasn't true. So we had to capture information within the hub to give people the right data, but from reliable sources. So we got different data from sources like the Ministry of Health into the hub to communicate things like social distancing, required distances, how to wear masks, the do's and don'ts, how to care about someone who is COVID-19 positive from home, among other information. All this is within the hub, and if you visit it, you'll be able to see more information regarding the same. The hub was also used as a communication platform. KCCA has a call center, but the whole of last year, during the peak of COVID-19, it was working 24/7. We have hotlines. People could call and get information regarding different things, but within the hub, we also had real-time updates from the KCCA Twitter handle, from the Ministry of Health Twitter handle, but also from the World Health Organization Twitter handle. And all these were giving people information, the do's and don'ts, and what to expect and what not to expect. Then we created different dashboards, one in regards to points of entry, because we know that Uganda is landlocked and we depend on the neighboring countries. We needed to understand the numbers of people who are coming in, especially truck drivers from the neighboring countries into Uganda and monitor their status. We also had a dashboard to monitor quarantine centers, the number of people who are getting in and those who are getting out, the new ones, the nationals and the foreign people, and all that kind of information was monitored through that dashboard. We had a dashboard for contact tracing for people who are COVID-19 positive. Who are their contacts? Where are they? How many have been gotten so far? And where have they been put? All this information was monitored in this dashboard. Then we had one which was monitoring the status of COVID-19 and its spread within the city. And depending on the information that we're getting, we were able to respond and take decisions accordingly as city administrators. We also had the Kampala traffic analytics for COVID-19 exposure. This analysis was done when it was time to open up for public and private transport, but the COVID-19 numbers were still high. So we had to monitor the different modes of transport that are used vis-a-vis the routes that people are taking and the different activity centers along those routes to be able to take an informed decision regarding COVID-19 and its spread, and to be able to limit the spread of COVID-19. This is how GIS was used to be able to stop the spread of COVID-19. And I must say that yes, we are successful. We've been successful in making people understand that it's important to use GIS for many other applications. Like I said in the beginning, Jack Benjamin said the application of GIS is limited by the imagination of those who use it. So that's how we're able to employ it for health, but we also use it for a lot of other things. Thank you for your kind audience.